Good afternoon, good morning, good evening from wherever you are. My name is Dr. Faith Mwangi Powell. I'm the CEO for Girls Not Brides, the global partnership to end child marriage. I'm delighted to be here this morning to join hands with our partners, UNICEF and UNFPA, on this global meeting to end child marriage. We are welcoming you from wherever you are tuning in from your sitting room, from your kitchen, from your bathroom, wherever you are tuning in from. We really want to say karibu or welcome. And today we are going to be looking at session 4, and we are looking at the new context of child marriage during COVID-19. We have a high-level panel. We have great speakers. You'll be hearing great things. And the first speaker we have this afternoon will be Claudia Kappa. Claudia is a senior advisor for statistics and monitoring and data at the data and analytics sections of UNICEF. And Claudia will be telling us about how child marriage data has changed since 2019, including issues around gender transformative approach. And we'll be thinking about how do we get back on track. So listen to Claudia very nice, clearly. And if you have questions, please post them on the chat. We'll try to answer them as we go along. And Claudia, welcome. It's an honor, privilege to hear you again. And you have 10 minutes. Thank you.
Thank you so much, Faith, and good morning, good afternoon, everyone. I'm so excited to be presenting the latest data that we have on child marriage, because of course, this is for us an opportunity to reflect on the progress that has occurred so far, the challenge that have been encountered, and also think a little bit about the future and the type of progress that is necessary for us to achieve elimination of the practice by 2030, the objective of the Millennium Development, the Sustainable Development Goals. So let's go into the presentation and let's look at, first of all, let me start by looking at the past. So let's go into the next slide. Let's start with an overview of the levels of child marriage before COVID-19. So this is what is displayed in the next slide. This is a summary of what has happened over the last 2 decades, approximately between 2000 and 2020. As we can see in the slide, across most regions, we have seen a decline in the prevalence of child marriage, defined here as the percentage of women 2024 were first married or in union by age 18. So worldwide, there has been progress, but the progress has been particularly fast in South Asia, mostly driven by the progress made by India. Other regions have slowed down, but of course not as fast. So Middle East and North Africa, for instance, had a time between 2000 and 2010 of decline, but then stagnation after 2010. And I wanted to point the finger at Western Central Africa, Eastern and Southern Africa, where there has been some progress over the last 10 years, but the progress has been slow and certainly not enough to make up for the demographic growth that's still occurring in these regions of the world. And lastly, I want to also highlight the case of Latin America and the Caribbean, where over the last 20 years, the level of child marriage, which takes form in the case of Latin America, mostly as visiting union and union as if married, there has been very little change over time. So what has happened as a result of this decline? And this is what the next slide is showing you. So going back to the last 10 years, you can see that the observed number of child brides has declined. And as a result of this combination of factors, there has been 25 million child marriage averted over the last 10 years. So incredible progress, 25 million child marriages that have been averted thanks to this progress. But it's always important that we ask ourselves, who has benefited from this progress? And let's look at the next slide. So these are the countries, this is a selection of countries in the world where the progress has been particularly significant because of the size of the problem originally and the amount of decline, but also because of the population of women affected by the practice. Look at the case of Bangladesh. The prevalence of child marriage was common, so common that 79% of women were married in childhood in 1994. now, according to the latest data, is 51%, still a majority, but dramatic progress. Similarly, Ethiopia, great decline in the prevalence of child marriage. India, from 61% of women married in childhood in 1991 to 27% in 2016. And in Indonesia, over a similar time period, the prevalence of child marriage has been cut by half. But in the next slide, I also want to show the case of a less talked about context and country, the Maldives, where in 1992, at the beginning of the 90s, you had more than half of young women who were married in childhood, so before age 18. And look at now, according to the latest data, the prevalence is barely 2%. So there has been a 25% decrease in the prevalence of child marriage over a period of 25 years. So what has occurred in these countries? Can we try to make sense of the significant transformation that occurred in this country that led to this drastic decline? Now, for all of these 5 countries, this decline in the prevalence of child marriage have been accompanied by dramatic shifts in terms of economic growth and poverty reduction, access to stable employment, but also in terms of access to education. Now, as we recognize the fact that progress has been made, I just also wanted to point to the fact that in most countries, this progress has not been equitable. Because while the majority of countries have seen decreasing rates of child marriage, approximately half of this country have also experienced increasing inequality. And this is what the graphs show. Each dot is a country, and these are different quadrants. They show you whether the decrease in child marriage has been accompanied by a decline in the gap between the richest women and the poorest women in terms of prevalence of child marriage. And you can clearly see that in most countries, there has been a decline in child marriage, but at the same time, the decline has benefited the richest more than it benefited the poorest. So it's an important reminder of the fact that as we work towards ending child marriage, we have to make sure that we lift up both the richest and the poorest women alike. Going to the next slide. So the progress has occurred, but the progress that has occurred up to 2020 prior to the COVID has not been sufficient to go towards the end of child marriage by 2030. And this is the projected level. If the progress continues as it's been the case over the last 20 years, if there is not a radical shift, if we don't promote significant change, the countries will still be having child marriage, and most of the region will not, actually all the region will not be on track to end child marriage by 2030. Now, on top of this scenario, we have to consider the impact of COVID-19. And this is what I want to talk about in the second part of the presentation. So going to the next slide, please. So we have seen that according to pre-COVID projection, because we were not on track, we already had a projected 100 million new child brides between 2020 and 2030. This even without considering the impact of COVID, simply because progress was not enough to contrast population growth and to meet the target of elimination of child marriage. So on top of this scenario, we have to consider the increased risk brought by COVID-19. So let's go to the next slide. So let's unpack a little bit what COVID-19 meant to the prevalence of child marriage. So we look at 5 different pathways in trying to estimate the impact of COVID-19 on child marriage prevalence. We look at the impact of the economic shocks, disruption to programs that specifically were targeting girls, interrupted education, increased risk of pregnancy, and parental death. So we did an extensive literature review and analysis of existing data to see how much these different 5 pathways could have had an impact on the prevalence and the risk of marrying in childhood. After this analysis, and this is what I want to show in the next slide, we retain 3 main types of impact: economic shock, disruption to programs, and interrupted education. We drop parental death and we drop unintended pregnancy. First of all, because these factors are already accounted for by interrupted education and economic downturn, but also because particularly pregnancy it's an important consequence of child marriage, but it's only in a minority of cases that early pregnancy actually lead to child marriage, and we are working now on a data analysis specifically to look at that. So we consider the risk factor and the impact, the increased risk of child marriage due to these economic shocks, but also disruption to programs and interrupted education. And we developed two scenarios. A first scenario that talk about what we expect to see in terms of increased number of child marriages due to COVID that are unmitigated, so without any intervention. But we also look at what would happen if actually there are new policies that are put in place to address the main drivers of this increased risk. And these are the results that I wanted to show in the next slide. So as you can see, the projected number of child brides, not considering the impact COVID, between 2020 and 2030 was estimated 100 million already, even not considering COVID. And additional 10 million, up to 10 million, are expected to be child brides simply because of the impact of COVID. With an increase in risk over the next couple of years, we are already here at this point in time, and an increase will continue until 2022, and all the way down to 2030, we will continue to have the consequence of the COVID-19 impact on the increased risk for child marriage. So to conclude, and this will be my last slide, progress is possible. We see that historically, many countries, including high prevalence countries, have been able to reduce the prevalence of child marriage in a significant manner. But we have to look at the period of 25 years, and we have to realize that this shift have gone hand in hand with significant societal, socioeconomic transformation in terms of access to employment, quality employment, not any employment, access to education, particularly secondary education, poverty reduction, have been all important factors. So these gains that we have made and these key factors that have driven these gains now are at risk because of COVID, because COVID is touching exactly upon all those important factors that have led to significant shift in the past in certain countries. So I'm going to stop here, recognizing the time, and thank you so much for your attention.
Thank you so much, Claudia. It's amazing to hear this. I've heard you speak and I'm hearing it again. I'm seeing the chat is live saying, what a wonderful presentation. I'm sure you have a lot of questions, so please put them in the chat and Claudia will endeavor to answer as we go along so that we make this very interactive session. But the first question I'll ask myself is, how do we get back on track? How do we get back on track to end child marriage by 2030? And the first person I want to hear some comments from is Monica Aika. Monica Aika is a child protection specialist with UNICEF Southern Africa Regional Office. Monica, karibu, welcome. You have 3 minutes. Thank you.
Thank you very much, Faith. Asante sana. How do we get back on track? I'll start by saying that it is possible to reduce the rates of child marriage, as we've seen from Claudia's presentation. And the most important point to ensure that we all do in order to get back on track is to address those drivers, those root causes that allow child marriage to happen. And in the Eastern and Southern Africa regional offices, and including our country offices, we commit to address all the gender roles that restrict girls' ability to generate income, and along with traditions like bride price and dowry payments that lead to being closely linked to financial security. So making sure that we have social protection programs that also support girls at risk of getting married and also those already in union to benefit from an alternative and also to gain into their rights. We also know that good quality education and poverty alleviation, including labor force alleviation, are very key in ending child marriage. So as we have seen significant reduction for this region, Ethiopia and Zambia are some of the promising, one of the promising countries with a significant reduction. However, in order for us to continue or to sustain our intervention, we are also committing for Eastern and Southern Africa region to do a lot of advocacy in the area of public financing for children, extremely important to sustain our intervention. And we are in the process of assessing the level of integration of national and sectoral policy and plans on ending child marriage, which is being implemented under the EU Spotlight Initiative, to really get to know what is the budget space that government has allocated towards this national plan of actions that are costed. So with that, I believe that we are able to end child marriage, but we need to ensure that we target the right intervention. Thank you, and back to you, Faith.
Monica, thank you so much, because you are giving us hope. Recently, we did have a presentation, and Yvette from the Gates Foundation was saying we need evidence-based hope. So you have actually just really lived that your optimism, Monica, is amazing. You've been very precise on the things we need to do. And I'll ask another powerhouse, Ramatu. Ramatu is a current senior child protection specialist for UNICEF Western Central Africa Regional Office. Ramatu, again, in your region, how do we get back on track? Again, you have 3 minutes, not a huge story, but really precise the things we need to do. Thank you so much. The floor is yours.
Thank you very much, Faith. Thank you. So what does it mean to be back on track in Western Central Africa? So as illustrated by Claudia, Western Central Africa is still the region where a girl born today faces the highest risk of being married as a child in the world. We have about 4 out of 10 girls married before 18, and pre-COVID, it was estimated that we would need to accelerate the rate of reduction of child marriage by 25 times if we were to meet the SDGs. So post-COVID now, what does it mean to be back on track? For us, it means that we need to accelerate progress, but we also need to do things differently, and we need to innovate. So COVID has showed us 3 things that I think we in this region, we need to focus on 3 priority axes. The first one is localization. Just as Mona has said, in this region, even if we have very high prevalent rates, we also have different drivers, different patterns that lead to child marriage. We have a difference between the Sahel countries, the Niger, the Burkina, etc., and the coastal countries, the Ghana, the Sierra Leone. We've also noted that we have differences between the patterns that lead to child marriage for girls under 18 and girls under 15. So, and COVID showed us that if we want to have a breakthrough, really, we need our programs to be much more agile, to be able to address those different patterns and those different drivers. And we have good examples in the region, for example, in Benin in this case. The second priority that we need to do is we all know that child marriage is a multisectoral issue. In Western Central Africa, we need to go beyond that, and we need to go towards integration. And again, we need to make sure that actually child marriage is at the heart of large-scale systems and schemes such as education, health, poverty reduction, where massive investments are made and have been made during the COVID period to make sure that there is a significant potential to transform the structural socio-economic environment of those countries. Again, I think this was illustrated in Claudia's presentation. We're having, for example, the World Bank working with the Niger to make sure that girls are back to school, and child marriage is at the center of this initiative. The third axis is partnerships. To be able to do so, to be able to work at that large scale, we need to be bolder in our quest, but also in the way we leverage the partnerships. We need to work with the World Bank. We're trying to work with the African Development Bank, the financial institutions. We also need to tap into the private sectors because of the fiscal space that we're having in the region, where we have government with very limited fiscal space, even though it can be used differently. And then to finish, what I want to say is, like, for us to be back on track, and COVID provided us this space, is to be innovative, is to be able to test and try. And I think a lot of countries had done that during the COVID period, so we need to leverage that, and we need to put in scale. Thank you very much.
Very well said, Ramatu. Absolutely fantastic. We have very clear 4 points for us to take forward. Accelerate, integrate, partnership, and advocacy. We need to hold people accountability. So as you think about this, don't actually think about the other person. Think about yourself, all of us who are here, 169 of us listening. Think about how you apply these things to the work you do. Thank you, Ramatu. And we have another powerhouse here from the Arabs and region, from the Arabs offices for UNICEF. And this is Dr. Elshi Shadia. and she's joining us. She's a medical doctor and really working as also a child protection specialist with the Arab office. Shadia, your floor is yours. You have 3 minutes as well. Thank you.
Thank you so much, Faith. Greetings from UNFPA Arab States Regional Office in Cairo. And actually, the question is very interesting. And when I've been thinking about it for when I received this call for the panel, in fact, for the MENA region or the Arab States region is very complex, not only because it's a region for people on the move due to the different humanitarian crises, but because also what Claudia mentioned in her report, the stagnation of decline in child marriage in the region over the last decade. Also, we have a very important opportunity in the region, the demographic dividend for young people, where young people represent 30% of the total population, and half of those are girls, but only half of those girls can go to school. So although the demographic opportunity represents a hope or an opportunity for the region, it's also a challenge, especially for girls. Another challenge that we face in the region is that the region also not only facing the current COVID-19 pandemic, but also other pandemics like the GBV and harmful practices in the region, where the region is home for 40 million child brides. COVID-19 added more burden on us, and especially for the anecdotal evidence for increasing child marriage cases during 2020 compared to the same period of time in previous years. What does this mean for us as UNFPA and UNICEF joint program, global program on child marriage? According to the recently published study for UNFPA and UNICEF, we have many good practices of alternative approaches to do the traditional programmatic work that we used to do in 6 countries in the region. And I take this opportunity to thank all the colleagues who exerted great efforts during the crisis in order to ensure that girls are safe and have access to services and information. I'm not going to give all the examples, but 2 of them, for example, in Morocco, UNFPA worked on continuity of sexual and reproductive health services and mobilized fund to improve the services. And also they managed to create an app to support women to access to information and ask them to receive services. In Djibouti, UNFPA and UNICEF worked together on child marriage through integration for the prevention of GBV and harmful practices, particularly for FGM and child marriage together. So to the main question now, what are we going to get back on track? The answer is 2 words for us, is accelerators and collective efforts. For the UNFPA and UNICEF regional offices, we're really working together to strengthen the cross-sectoral engagement. And we had several discussions, me and my dear colleague Indrani, who is in this call with us, about how can we do that, and about the importance and how imperative this to ensure that we have different entry points to address child marriage prevention and response, including different sectors, either C4D, gender or child protection. And actually, we are having a meeting next week in order to discuss this at more strategic level. Another element is that to strengthen evidence-based programming, and with the current evidence we have now, we are going to revisit our work plan either at the regional level or countries level in order to ensure that we are up to date with the current situation, and also to have our programming fitting the new context. Also, when we are talking about identifying accelerators, we have to keep in mind that the clock is ticking for 2030. And in order to do that, for collective efforts, we need to have strengthen strategic partnership at the regional level, for example, with the League of Arab States. Another strategy, which for me is very, very important, is to consider girls as partners, not only as target audience. And for engagement of girls in the different parts of the program design and implementation, while also considering the subpopulations of married girls, divorced girls, or wedded girls. And in this context, I would like to shed the light on one of the programs that we have been supporting at the regional level for 2 country offices, Egypt and Jordan, which is the assets framework, the Girls Assets Framework, which is basically to empower adolescent girls through building their health, social, and economic assets in order to achieve and reach their full potential. And 2 days ago, Egypt actually launched the program at the national level, and they have big partnerships with great stakeholders from the country. So I would like to congratulate them if they are online. And it's a hope and a learning process for us to do that, especially at the time of COVID, and have these lessons learned to share with other country officers. And thank you for listening.
Thank you so much, Shadia. Thank you so much. And I noticed that I gave you a new job, that you work with UNICEF, but I know your family, so that is fine. Sadia is working with UNFPA, working on child marriage and FGM. Thank you for that, and sorry for that error on my behalf. So we have a final powerhouse, and this is Upala Devi. Upala Devi is the regional gender advisor for UNFPA Asia Pacific Regional Office. I got that right. And Upala, again, we are talking about how do we get back on track. You have 3 minutes. Thank you.
Thank you. Thank you so much, Faith. And greetings, colleagues and fellow panelists and all participants. And thank you for inviting me to be a part of this panel. I'm going to be very brief, and I'm going to speak, of course, from the perspective of South Asian region. And as Claudia very aptly highlighted in her presentation, I mean, the rates of child marriage in South Asia are very, very high. And though there have been some very positive downward trends that are happening, for example, India, we have, on the other hand, the other side of the picture, where we have a huge spike in terms of gender inequality, gender inequity. So while we have downward spikes in terms of child marriage, we have upward spikes in terms of gender inequity and inequality, and they, of course, feed each other in terms of reinforcing harmful social norms. So though the full impact of the pandemic...
Upala, you seem to be frozen. If you can...
Sorry,
maybe...
Can you hear me?
You seem to be frozen and you are cutting a little bit. Not quite. Could you try... Hello? We can hear you. Hello? Can you hear me? Try now. I think try without your video if you can hear me.
Yes, you can hear me now?
Yes, that's better. Yes. Yeah. Mm.
Yes. Can you hear me?
Yes, yes.
Okay, so can you hear me now? So do you want me to start from the beginning, or do you want...
We had a bit at the start.
I'm going to start again with the greetings, and yes, but what I'm going to do is that I'll take from the perspective. All right, so I'll start from where I talked about Claudia and her presentation, where she talked about, for example, India, where you see a downward spike in terms of child marriage, but on the other hand, you see an upward spike in terms of gender inequality and inequality. So while we have some positive trends, we have some downward trends, and in a way, these reinforce each other and harmful social norms, including child marriage. So though the full impact of the pandemic is still highly uncertain, we know that there are actions we can take to protect girls that can wield lasting benefits. And already there are many innovations that are occurring in the South Asian region on the global program to end child marriage, and which are already serving as exemplars, if you will, good practices that can be replicated and scaled up. So what were some of the solutions and opportunities? From the South Asian context, and I see that my fellow panelists also spoke to some of the same solutions and opportunities. Firstly, include creating and sustaining a protective legal and policy framework, addressing social and behavioral change, ensuring the continuity of services, and making, as Claudia also for girls and their families, safe reopening of schools and girls' access to reproductive health services are paramount. Further, adapting and strengthening child protection system, services, along with social protection, such as cash transfers for low-income families in particular, could be fundamental in helping them meet basic needs resorting to child marriage. And I want to just focus a bit on delivering of sexual and reproductive health information services. Part of
your sound is breaking.
So when we look at child marriage, COVID-19, and new modalities, some of the new models of delivering sexual and reproductive health information and services will need to reach girls already in contact. New modalities of delivering sexual and reproductive health services and information will need to reach girls that are already in contact with health, as well as those who've never had access. Adolescent girls and boys as well, which is very important because they do form a part of our picture, should continue to have access to sexual and reproductive health services as part of distance learning using radio, online platforms while schools are still being closed and physical distancing policies are in place. We need to remove barriers to accessing services by use of, for example, virtual consultations, helplines, etc. And this is key as these are modalities that are key in including sexual and reproductive health services as part of the universal health coverage systems in these countries. Finally, protecting girls from early marriage will require extensive outreach, targeting those not just directly affected by the pandemic, but also those who were even disadvantaged before the pandemic began. And we see that as more evidence is emerging from the Asia-Pacific region on what has worked amid the pandemic. We see that it's clear that, as some of our other panelists also mentioning, is that we require multi-types and we require innovative approaches. For example, in India and Nepal, we have the virtual health and psychosocial support consultations, including support for adolescents in both India and Nepal who are facing abuse or child marriage. And they are being made available through remote distance radio, helplines, and mobile phone technology, for example, in India. So finally, making sure that no girl is left behind because she's poor, illiterate, or too young really requires deliberate planning and a multi-stakeholder approach, an action of not just part of the governments and the UN, but a range of partners in society and the private sector. And finally, as we contemplate what a post-COVID-19 region and the world in general will look like, we have the opportunity to build on what we will do in the pandemic. We must not only commit at this point, for example, during this global meeting, but we should also take concrete actions to bridge gender and socioeconomic disparities and divides to advance rights, choices, and opportunities for all. Thank you so much again. Over.
Thank you so much, Upara. Despite the, can you hear me?
Hello, can you hear me?
Yeah. I think I'm frozen.
No, you are okay, Faith.
Oh, great. Yeah, Upara, thank you so much for that intervention, despite your challenges with the internet. So thank you. Thank you. You have shared great insight, legal framework, opening schools, access to education, social assistance, including cash transfers, using distance radio, multi-sectoral sector approach. And really for us, you even called us a challenge on taking more action ourselves, even beyond this meeting. What can we actually take action to go do? And at this point, we also want to hear from all of you, the 164 of you online. So my colleague, Katrina, will tell us how we are going to use a platform to respond to a question she wants to pose to all of us. Over to you, Katrina.
Thank you, Faith. So some of you have already tried it out in advance in one of the previous sessions. So we're going to run a quick Mentimeter. I'm going to post this also in the chat. So please click on the link I just shared in the chat. You then should also be able to fill out the question. And the question we are asking you is, from what you have heard just now, what resonates most with your country, program, or region? So please just click on the link in the chat, or alternatively, you can also grab your phone and go to www.menti.co and add the code 92614364. And I'm going to share my screen while all these responses are coming in. So for those who haven't had a chance yet, just click on the link in the chat, and then you will be able to fill out the question. In case you have any difficulties with Mentimeter, you can also just use the chat in Zoom and answer the question there.
This is amazing. Very good. Keep responding. We want 163 responses. This is so good. Thank you so much for doing this. Has been a very rich conversation. Just shows how much you can do with a short time. So addressing poverty, discriminating norms, cash transfers, girl education, reduction in child marriage in Ethiopia, links to government, requires more analysis in Ethiopia. Claudia, there is a call for you, more analysis in Ethiopia. Important to engage men and boys. Cash transfer, participation of girls, social protection, lots and lots and lots of things here. But as you do that, if you've already answered, if you have any question, please also type it in the chat so that, and really say who you are asking of all the big powerhouses we've heard from. If you have a question, please type it in the chat. We have 10 minutes and we'll be looking at that. There are so many great comments. I think many of you liked the presentations from Claudia, and I hope that will be shared and available so that you can analyze it and study it carefully. Many of you loved what you heard from all the regions, what people are committing to do. There is a lot of commitment, and my charge to you is that if you can take all that and think, I don't know where you work, I don't know who you are, if you can take all that, what has been said, and see, how can I accelerate what I do? How can I do more? How can I be partner more? I really like that call of partnership, because I think one of the critical pieces of this work is that we cannot do it alone. So who do I need to reach out to? And sometimes we reach out to the familiar. Who do I reach out to so that I can be bold in my partnership? So you need to think about that. But I don't want to keep talking. I want to give you a chance to speak. So if you have a question, so there is one question from Jackie. Jackie from Girls Not Bright says, how do we, sorry, kind of went where I was trying to read it. I'll look at it. How do we build equitable economic systems? The latest evidence published shows that while there has been progress on child marriage, the prevalence has increased for the poorest households. So maybe this is a question for maybe anyone really from the panel who wants to do that. How do we build equitable economic systems? Does anybody wants to go for it? Or shall I call you up? Ramatu, how do we build equitable economic systems?
I knew, Faith, you would call on me. I don't know, I had this feeling. So, okay. So I am not sure if we are to build the systems, but it's also what I said. I think that we need to make sure that us working on child marriage, we're actually partnering with the other powerhouses actually that are working on the social economic systems in the country. In our region, that's why I was saying we are trying to work with the World Bank. We're trying to work with the financial institutions that are not normally, I would say, our usual suspects in terms of working with child marriage. But as Claudia's presentation showed, when we see decreases in child marriage rates, it actually goes hand in hand with improvement in economic systems, in actually growth and also inequality. So I think it's up to us to look and to go towards these partners and to actually show, and this is what our Niger country has done, for example, to show how actually if we do not invest in child marriage, if we do not take child marriage as a critical issue on the national agenda of our countries, that basically we will not reach economic development, will not reach social development. Thank you.
Thank you. It's because you wore blue like me, and I love blue. So I'll ask Shadia, do you have anything to add on that? I think it's very good. Do you have anything to add?
Yeah, in fact, I have. So I think also in order to build equitable economical systems, we have to involve girls and young women in the process from the beginning. So for example, if we are speaking about building the economic assets or financial literacy for young girls, this is something that they will carry throughout their lives, and also they will manage to be either beneficiaries or advocate to this within their communities. Another important factor is that partnerships with other stakeholders who are working on this area, and also to ensure that there is a gender transformative approaches within this organization to ensure that we are reaching our goal.
Thank you. I will not ask, there was somebody who had put their hand up, if any. I saw the hand, or is your question answered?
Yes, no, my hand was up, yes.
So do you have a question?
Yes, I have more of a question.
All right, go ahead. Go ahead.
All right, thank you very much, ma'am. So my question is, when we are talking about re-strategizing, it's a very important tool in transitioning to a new development when we talk about child marriage, because COVID-19 has really brought something terrible to us. It has destroyed the system and it has made things really slow. For example, in my country, in Nigeria, you see that I believe that some country offices are also facing, this, let's say, a framework to strategize and be more innovative. So how do we help these developing partners, and how do the headquarters ensure that country offices are strategizing well in order to deliver more? Thank you so much.
Thank you. Maybe I'll pose that to Mona. Mona, do you have any response to that great question in Nigeria? And also Upala, if you have any comment on that. Yeah.
Thank you. The question from Nigeria is really asking, how do we strategize? And examples were given about COVID-19 and how that impacted on our efforts to address child marriage. And I'll say one of the most important steps to start off with, something that we've also done in Eastern and Southern Africa, is to take stock, to reflect on what happened at the onset of the pandemic. We're still faced with the pandemic, and pick some lessons learned on how well we've managed to re-strategize and even ensure that continuity of their interventions are implemented, and really taking on board that measure on, one of the recommendations that came from this region was that we need to have systems that are robust enough to be able to, sustain or to be able to be functional during emergencies or pandemics like this. So what can we do in that aspect to see what lessons have we learned? We know that, even during COVID-19, we still managed to have countries implementing, some of the interventions that are quite promising. And we've seen most countries were able to place increased focus on advancing gender transformative interventions that empower girls through life skills training and education, and really encouraging critical reflection in communities among, men and boys. So my response will be, Faith, to the Nigeria, from the Nigeria speaker, is that what have you learned during the pandemic, and how can you ensure moving forward you incorporate those lessons learned to improve the implementation rate? And also, just to finish off, the presentation that Claudia made on the prevalence of child marriage and how we've seen a decrease in the rates of child marriage over time, over 25 years, over a decade, and so forth. So it means it's possible. And we're also seeing that, the children who are living in poor households, children who are not educated are the ones who are at risk. So how can we design our intervention to address those gaps or those issues that children face who are at risk of child marriage? Thank you, Faith.
Thank you so much, Mona. We will close with a question from my friend Haida in Nairobi, asking Claudia. Haida, it's good to hear from you. We haven't connected for a while, and he's asking Claudia a question which is in the text. So Claudia, I don't know whether you can see that question about how can we be sure, maybe somebody can flag it up for you, Claudia. I think there's so many texts. Oh, great. If you have seen it, you have maybe 1.5 minutes to answer that, because we need to close now.
Well, I think 1.5 minutes or 1.5 years will not be enough to answer this question, because we cannot establish a one-to-one relationship. This type of data, this type of analysis are not establishing causal link. We cannot do that. We can establish associations and see that in these countries there has been this shift that have occurred. Now, the relationship of the shift, who comes first and who comes after, of course, we can try to mitigate by doing a temporal analysis, but we cannot say one equal the other. That's not what we can do. Not even the perfect study design will allow us to do that. Of course, what this analysis underscores is the importance of thinking about opening up opportunities for girls. Because child marriage is a decision that is made, and as all decisions, it is based on a number of parameters. or a number of push and pull factors, right? So of course, thinking about employment opportunities, and employment that is sustainable, stable, not vulnerable, this is a trigger for child marriage, which means obviously quality education that is linked to opportunities later on. So it's not a one-to-one causal relationship. These are important associations which resonate very well with what has been discussed today about the importance of making sure that we give options to girls that they can relate to and they are sustainable in the long run. So thank you.
Thank you so much, Claudia. I couldn't have said better myself. And this brings us to the end of this session. I know there are many questions, there are many comments, but please be in touch with our colleagues and friends at UNICEF, UNFPA, the Global Programme, you know where they are. And also know that this global meeting is going on until the 21st. So stay linked in, stay hooked up so that you hear more and you learn more. But the message I want to leave you with is accelerate, accelerate, accelerate. We have to deliver the promise of 2030. It's been an honor and a privilege to be part of this conversation. I thank you and I wish you a great afternoon. There is another session in the afternoon and Catherine will tell you about it shortly. Thank you and have a good day.